this panel discussion. Today we're going to be talking about the e-pharmacy market and why e-pharmacies could become the backbone for the digital healthcare system amid the COVID pandemic that has been hitting India as well as the world. But before we go on to our panel discussion, let's take a look at what really e-pharmacies are and what their role has been so far in India.
The term e-pharmacy refers to the online pharmacy that offers medical care and provides the ability to prescribe medications for patients online. It makes use of the internet and delivers medicines to customers through dedicated delivery companies. Ernst & Young estimates India's online pharmacy sector to grow to about $2.7 billion by 2023 from $360 million in 2019. This boom in the sector is also driving other pillars in the digital health ecosystem such as online consultations, remote diagnostics and home healthcare services. Data sourced from research firm Karagato suggests that the rate of usage of pharmacy apps in India have on average nearly doubled and in some cases tripled. Data also suggests that the time spent on these pharmacy apps has also significantly increased. Online pharmacy laws in India are still in its nascent stage and there is an absence of a clear regulatory framework from India's policymakers. Industry associations that claim to represent offline brick-and-mortar players have also accused online pharmacies of hurting competition.
Very warm welcome to this very engaging discussion on the e-pharmacy market in India. It's a market that has been growing slowly but surely, and now with the COVID crisis that's been hitting India and world over, we are seeing a significant boom in growth as far as the whole e-pharmacy segment is concerned. In fact, the estimates indicate that this market is expected to grow to more than $2.7 billion by 2023, and it's been growing at a CAGR of 18%. I have with me a very power-packed panel, members of the e-pharmacy segment. I have with me Mr. Madhukar Gangadi from MedPlus India. I have with me Gaurav Agarwal from 1mg and Kushal Bhatnagar from RedSeer. Thank you, gentlemen, for joining us today on this panel. I want to begin by asking you about the state of the e-pharmacy market in India. Now, we've been seeing statistics that the market has significantly boomed. Sales on e-pharmacy platforms have more than doubled. I want to begin by asking you, Mr. Madhukar, if you can run us through what your experience has been over the last couple of weeks.
Priya, as you may well know, we are an omni-channel pharmacy here. We have both offline stores. We have around 2,100 stores across the country. But a significant portion of our business now comes from the online side. So we have seen a huge increase ever since COVID started last year. And I don't think, let's say, we have been able to manage the whole thing, as well as we could have. The demand is there. Even in the current thing, since last March, we have seen almost sales of e-commerce site, that channel go up nearly 2.5 times. And unfortunately, the big problem for us has been the lack of manpower, both the warehouse and the delivery side. We've been struggling to actually meet the demand. The demand is there. I'm pretty sure, Gaurav will also testify to that. People are moving online. They clearly, the channel is already mature. It's been on for a long time. People see the need to, protect themselves from coming out and all. And they are taking the benefit of this online channel out here. But as with everything else, you can never basically be fully prepared for demand of this kind of nature. We are, unfortunately for us, a lot of our people at warehouse and the delivery side have been falling sick. The demand has actually gone up to 2.5 times. And on the supply side too, we've been unable to get all the products out there. But all in all, I think, we would have moved a significant portion of our own customers and also, people who would otherwise shop at other shops to the online channel. So that way it's been good. I only wish we could, serve the entire channel much better than what we are at this point.
Right. I want to come to you, Gaurav Agarwal. You've been through the first wave of the pandemic and now we're in the second wave of the pandemic. What changed in terms of the kind of engagement of users on, the e-pharmacy websites and apps? What's been your experience over the last couple of weeks? How different has it been from the first wave?
I think, I'll echo Madhukar's thoughts. I think from a demand side, it hasn't changed much, right? There's a sort of like 2-3 factors in play here. First is that there's a general lockdown across the country in various measures, right? So people are finding it hard, finding it tough to go out. Second, people are actually sick, right? So they can't really go around driving to a pharmacy and looking for stuff. Right. And the third is actually people are worried as well because, there is a risk of catching an infection if they go out, etc. So all of these things have precipitated the demand to happen. Now, the same demand surge happened last time as well, where we found that, we could scale back on all our marketing, etc. efforts and yet, operate at a 2 to 3x sustained demand from our regular demand rates, and 1mg as a platform grows over 100% year on year. And on top of that, we were seeing, 100 to 150% scale up in our daily demand. So we are seeing that same trend repeat this time. I think the one big difference that I would say from last time is that the supply situation and the movement of essential goods seems to be better sorted out this time from day zero. Right, last time was the first episode of lockdown. I think the local law enforcement agencies, etc., on the ground were still figuring out this essential pass and how do we let people through, etc. We faced, at least for the first couple of weeks, we faced a lot of issues with our riders getting held up. This time around, those issues have been almost zero. Right, that's one. I think the second is that supply-wise, while I agree with Madhukar that supply is a challenge. For instance, I'll give you an example. You can't. It's very hard to secure Budokort inhalers, right? They come and they run out of stock the next day, right? Or it's very hard to get Medrol 8 mg tablets, right? You can only get 4 mg, and someone who's prescribed 32 milligrams of Medrol in a day has to have 8 tablets, right? So those things are there. But supply situation, I would say, is marginally better than last year, right? Where people, I think, got into action sooner. They got prepared. They got prepared sooner. And to some extent, I think things are better. People have also figured out alternatives, right? Alternative arrangements. So if, let's say, a particular brand is not available, then the doctors are writing prescriptions with substitution allowance, etc. So I think that's also sorted out the situation. That said, there is still a lot of supply gap in the market, which all of us are working hard to fill.
I want to come to you, Kushal Bhatnagar. You've been doing the number crunching behind the scenes in terms of how these players, have been sort of charting their business growth. But I want to understand from an overall business, do you think that e-pharmacies could become a significant backbone of the entire digital health, of the e-health ecosystem, considering that slowly but surely in India, they are becoming a prominent part of the entire chain at this point?
Yeah, I think definitely. I mean, there are certain things that really happened during the pandemic which kind of confirms this. One was when the Home Ministry or the Health Ministry itself declared e-pharmacy an essential service during the previous lockdown, right? That was a big win for the sector, and that was the government giving a nod to the sector that we do consider it an essential part of the country and the way the digital health is going to involve. Second is how the e-pharmacies kind of went beyond their zone of just serving the top cities and went into the inner areas, including tier 2 markets. That kind of built a lot of awareness among the consumers, which are not very used to this channel or didn't really know about this channel much. But that's how they have been expanding. They're not just serving a particular set of demand. They're now serving a much larger audience and on the right track to reach the masses. So I think definitely their potential is there. And because of the pandemic, the awareness is there and the need is there as well. I mean, in our consumer surveys, while prior to the pandemic, right, most of the consumers used e-pharmacies for better value, or better discounts, better offers. But recently in the pandemic, we saw that convenience, the added convenience that e-pharmacy players provide by delivering drugs safely at a consumer's doorstep was the primary reason to use these services. So there's a shift in the mindset as well of the consumer that's happening. So I think combining all these things together, there's a definite backbone that these players have to offer in the system.
Mr. Madhukar, I want to come to you, e-pharmacies are concerned and omni-channel model that you spoke about. In terms of overall demand demand and the key trends that you see panning out? Which pockets do you see maximum demand coming in? Are you also seeing medical devices or equipment seeing a lot of traction at this point in time?
Depends on what you really call medical devices and all, right? There are some OTC devices like pulse oximeters and all, which are selling a lot and which are easy to, ship and everything else. But, for the stuff like oxygen concentrators and all, I'm not sure if medical stores are really the place to sell. I think it's more likely the e-commerce channel, which will basically sell more of that. We are seeing demand from that side. Unfortunately, though, the supply has been extremely, I would say almost negligible. There's no concentrators to be had for any cost at this point of time. So we will see what happens. But I would say seeing demand across, while as Gaurav said, this time around supplies have been better. Unfortunately, they've not been as good for the real drugs which are really necessary. Now we're seeing a huge, demand for drugs like tocilizumab and Varinat and all. Both of those are not available for any amount of money. They're only available directly to hospitals, and that too, they're rationed extremely heavily. Remdesivir, which basically can cut the overall size of the illness or duration of the illness, has also been huge short supply. Again, I would say as someone who sells drugs, we're feeling a little helpless in this thing at least. Right now, not being able to give the real life-saving stuff out there. Instead, we're selling a lot of vitamin C, zinc and all, absolutely selling a ton of amount of that, and supplies have been great for that. But the fact that for the real things which matter, India is not able to produce enough. We're not able to produce enough vaccines, enough remdesivir, or enough of tocilizumab. So really, what are we doing? Basically, it's just giving the dolos and this thing else, which I'm sure is good. So when I said supply side, what I meant was unable to give out oxygen concentrators, unable to get remdesivir, unable to even promise our employees vaccine, and finally unable to get the tocilizumab. So demand has been great. I only hope supplies kind of at least come closer to demand right now in the coming weeks.
Do you think e-pharmacies at this point in time can become full stack players, offering end-to-end services to customers, right from teleconsultations to delivery? I want to pose this question to both you, Mr. Agarwal and Mr. Madhukar. If you can run us through how important and how soon can e-pharmacies become full stack players? Mr. Agarwal?
Look, so I know 1mg often gets clubbed as an e-pharmacy. We've always said from day zero that we are not an e-pharmacy, an integrated platform. And today, if you look at our business, we run one of the largest consultation services in the country, probably one of the largest diagnostics, and this is when you put offline and online players both together. Our diagnostic business is truly large and growing very, very rapidly. And the same is true for pharmacy as well. So, but that said, these are very different skill sets to deliver, in the sense that the product requirements that you have for what a consumer interacts with are very different. The clinical supply chain, pharmacy is at the end of the day, for lack of a better word, and I'm not trying to belittle anything, it's a packaged product delivery, right? When it comes to diagnostics, where you're going to someone's home and actually drawing a blood sample, right? It becomes very, very complicated. How you draw, what you draw, what's the pain level, you draw enough sample or not in the right vials, it becomes extremely important. And the same is true for consultations, right? Where the quality of the doctor, the time of response, etc. So, given enough time and money, you could argue that anyone can do everyone can do everything, but we have seen that there is a cultural and organizational DNA that comes into play, right? For 1mg, our DNA has always been around integrated healthcare, and we view pharmacy as a small sliver of healthcare needs of a patient. And in this pandemic, what 1mg has seen is that our consultations are like 5x more than what they used to be earlier. Our diagnostic business is 4 to 5x more. In fact, I'd set a goal for my team that by the end of the year, we will grow our diagnostics business to 3-4x. We have already breached all those numbers. And we are like, it's the classic, everything that could break with the diagnostics product is breaking, and we are frantically fixing everything and in a much better state today. So for us, the demand has been across all the sections of our business. I don't think we could have started that today and scaled it. But the fact that we were doing it for the last 5 years and had developed a lot of expertise in this area actually helped us scale this business, now that a real demand surge came.
Before I come to you, Kushal Bhatnagar, I want to talk to you, Mr. Madhukar. What is your view on this? Do you think e-pharmacies as a model could become a full stack operation?
Full stack here means hospital. Huh? Full stack means sitting in the hospital, getting the oxygen. Full stack is not, anyone can get information from WebMD today.
Yeah.
So let's not say full stack. It is consultation, diagnostic, which is picking up the sample from home or going out and basically getting it done. So while there's always going to be a market for people who want everything at home. As a country, India is large, cannot really afford the price of most of the things. Most of the people cannot. So if you actually want to go down to the bottom of the pyramid or even the middle of the pyramid, if you start basically sending home doctors and lab technicians and all, believe me, there's not going to be enough lab technicians in the country. A. B, they're not going to be able to afford it. We consider it, while we will do the service for people who want it at home and who definitely cannot come out, I prefer using the lab technician in my lab so that people can come and use the facility out there to draw the sample out there. Way cheaper, much more affordable, and much more scalable. See, for instance, there's not that many phlebotomists out there. If I'm basically sending it to one guy's home, he goes for 40 minutes and comes back another 40 minutes or something like that. If he can pick up 16 or 20 samples, if he's working like a Superman, flying from one place to another, does 16 samples in a day. That's not cutting it at all. My stores, while I love my e-pharmacy part of the business, my stores serve more than 250 people a day, customers. My labs, which basically get people to come out there, serve 200 to 250 people easily. That's where we see the big thing out there. Yes, full stack is going to be there. Definitely for people who can afford it. Right now, possibly some this thing. But to think that e-pharmacies will eventually replace everything out there it's a notion which basically is totally flawed, I would say. So I won't even try to put it. So a portion of it will always be there, 100%, right? I mean, this is one more channel and people will use it. Eventually, people will have to start paying for it. You can't basically get it financed by venture capitalists and private equity guys forever. Eventually, and we will see when they really have to shell out, how many people end up actually wanting to shell out that money. You'll see most of them basically trudging along to the nearest collection center to give their samples.
Kushal, I want to come to you right now. When you talk about e-pharmacies and, the ways to improve customer engagement, what do you think e-pharmacy should do at this point to improve the kind of customer stickiness, loyalty, and also engagement with the overall audiences?
Yeah, I think there are certain things that they're already doing that they should continue to do. For example, I mean, the kind of information about some, there's a lot of awareness information that is very important these days, that there are certain practices you should follow in day-to-day business to keep yourself safe. I think all of these pharmacy platforms, they're not just selling medicines, they're making sure that customers also get those nudges on their mobile phones or when they get on the website. So there's a lot of awareness building that these companies can do, and they're already doing that pretty well. There's a bunch of information that can be put on their websites about medicines, because people do have a lot of questions about what is the exact ingredient, what are the side effects. So I think people do like to read about that, and that information is currently in the chemist's head in tier 2+ towns. So they rely on the chemist to provide that information. If they get it on a digital source, people will be very engaged to be on those platforms and read through that information. I think I read in some media reports, and the situation is changing on a daily basis. But at this particular time, I think I've seen that certain e-pharmacies are also trying to partner with corporates and societies for the vaccine, about the vaccine thing, right? Which is kind of very important today, because we have some certain supply of vaccines, but the demand is a challenge. Now people are not going to hospitals because that is a challenge, right? So this vaccination information about vaccination, about how people can get it done in the current times, that's another point of it. And I think the fourth point, which I believe is very important, and that's something you already mentioned, we just discussed it, is about the full stack model. I do think that when you diversify the services, and that's something we have seen across e-commerce, when you just don't keep it pharmacy, you include consultation, you include diagnostics, you include some other things as well, like content, right? That is where people get more engaged to be on your platform, because you're not just relying on one particular service to tap a customer, to acquire a customer. You're relying on a full range of services. Those are some of the things that companies are doing, and it will be very impactful in the future as well.
One topic that's been the most spoken about topic right now is the vaccination drive, and the role of e-pharmacies in this vaccination drive. Gaurav, do you want to tell us what 1mg is doing as far as the overall vaccination drive is concerned? How many corporates, private societies, etc., are you all going to be tying up with, and when can we expect this vaccination drive to really begin?
Yeah, look, I think there's a lot of flux of information. What we know at this point is that there's massive supply issues, especially because there's a huge push from both the central and the state governments to get folks vaccinated. And based on the capacity that we have, production capacity that we have, most of the supplies today are actually with the central and state governments, which are trying to vaccinate people at the highest rate possible. That's one. What is happening in parallel is that companies like Serum, Biotech, etc., they are actively and furiously working on scaling up their production capacity, right? So from our estimates, it seems like in the next 2 weeks or so, production capacities will be higher, and there'll be more, let's say, capacity available for companies as well, right? The third is the government has actually made import of vaccines actually a lot more liberal now, right? Private companies, corporates can import vaccines, etc. So that should hopefully ease some supply, pressures as well. 1mg, our biggest advantage is that we have a very, very strong hospital network, and we have a very strong team of administration, in the sense that we have over 1,000 phlebotomists who do diagnostic sample collection for us, who have all also been trained to actually do vaccinations, right? So nursing staff, phlebotomists, etc., they are all qualified vaccinators at this point. So we are partnering with hospitals, both large and small, to actually make administration capabilities available for corporates, right? That's what we are trying to do, both factories, corporates, logistics companies of the world. We have partnered with over 600 plus corporates at this point, and we are working, like everyone else, we are working on basically getting the vaccination supplies figured out. There's a process and method to the supplies now. So as we know more, I think we'll be getting the camps and the CVCs. There's an industrial CVC concept, which is the corporate vaccination center concept. We'll probably, that would be the right avenue for us to start to vaccinate people. But still a couple of weeks away, I would think.
Mr. Madhukar, with MedPlus India, are you also going to be tapping into the $1.4 billion vaccination, pool? Are you also going to be, having partnerships with other corporate societies, etc.?
Of course. I see it as a national effort to get everyone safe, not necessarily as a $1.4 billion market size. I think it's the duty of almost everyone in healthcare to basically get this job done. I don't think there's enough doctors and enough nurses right now to get it done, right? We will require at least 200 crore doses, right, in the next 6 months or 1 year or whatever. I think we have done 12 crore odd people have been vaccinated till now. Even if you assume only 100 crores will ever get vaccinated and rest 30 decide not to do it at all, that's 200 crore doses. And the way the government has set it up right now, 100% or something like that, ridiculously, out of this thing, I would say out of proportion to the overall size of the problem. I think 1mg will have to do it, pharmacy will have to do it, we'll have to do it, everyone will have to do it. I don't think there's really any other option. We would want to basically get the whole country vaccinated in the next 6 months, which basically means we're talking about roughly around 30 crore doses, right? 30 crore doses every month, a crore every day. So I'm sure the 1,000 of 1mg and maybe 1,000 of Apollo and maybe 2,000-3,000 of everyone else will not be able to do the thing. This has to be done. We are working on it. We are presently in 135 cities across the country, 7 states. We have around 3 lakh people coming to the stores every day. We are, getting all these guys, tuned to, getting them signed up for, and when the supply is actually available, I think the key thing is going to be supply of vaccines. We don't know when they'll come. They are all saying it'll be there, but we know what's happening on the ground right now. Hopefully in the next 2 to 4 weeks, imports will start coming in. The local guys will start stepping up. And but the other big challenge we will see is the people who will actually vaccinate, right? It's not as if doctors and nurses and phlebotomists are idle at this point of time. They all are basically, barely able to meet the demand which they have. They're not able to get the samples drawn for testing. So I'm not sure where we are going to get the people to actually vaccinate. So everyone will have to work overtime, double, triple time. Or maybe nurses will have to work in a hospital, come back and work somewhere else to get the people vaccinated. It will have to be done. So we are planning for that. Very conscious of the fact that manpower is going to be a big challenge. But we're training our people. Hopefully we'll be able to do our bit. Hopefully we'll be able to at least get a portion of the country vaccinated through MedPlus. That's the goal for us. And hopefully we can get it into it.
I think the government notifications recently on using pre-medical staff and making them available as workforce is actually going to be extremely critical to just supplant these workers for, let's say, things like vaccinations, etc. So I'm hopeful that we'll be able to figure something out. As Madhukar said, as a country, it's important to get everyone vaccinated. That's the one sort of, sure shot thing we have, at least to reduce the severity of symptoms and reduce hospitalizations. So we all just need to come together and figure out a way to get it done.
Talking about government and regulations, I want to come to closing comments from all of you, beginning with Kushal Bhatnagar. Kushal, tell us, the e-pharmacy space is still not very clear as far as overall regulations, policy frameworks are concerned. What, according to you, needs to be done so that there is more clarity in the sector at large?
Well, I think whenever we talk about e-pharmacies on any portal, I think this is something that always comes up. As a key question. I think generally we already have the draft rules in place. I think the pharmacy sector has been waiting for a long time now for them to be notified. I understand that the government also has certain priorities to take care of this point of time, but I think definitely that notification should come through, if not today, but in the near future, because I think it's not so much about e-commerce. It's not just about securing what a lot of players are doing and securing their business. Now it is about how this company runs and what is a priority for people now. Now this will not just be a pandemic thing. This will become a new way for people to order medicines, to speak to doctors, to kind of get their tests done, right? So it's not just limited to a particular month or a particular week. It's just something that's gonna be there for longer term, and people are appreciating it. But I think I really like the fact that during this pandemic, government did give some green signals to the way the e-pharmacies have been functioning in this country. As I said earlier, that these services were declared essential. While there is a gray area about notification of rules, but this is still an essential service. So that's a definite green signal for the sector. Secondly, even by the health ministry, there were guidelines wherein they encourage the use of e-consultation to prescribe medicines. That was a big go ahead as well. So I think the government has been giving good signals, and I think if not now, but in near future, as the government gets out of this mess currently, there will be a notification that should happen. And I think the sector really deserves it, the way it has kind of flowed in the last few months.
I'm not really thinking anything at all about the government thing. I don't think it's the government which makes or breaks any business. I think e-pharmacies have been doing whatever they've been doing, irrespective of what the government has done. Although I must say the unfortunate event which is just unfolding here, I've seen two things. And to me, the more important thing is people accepting e-pharmacy as a way of ordering medicines, not just for price, but for convenience, as Kushal said a little while earlier. If people start valuing it for convenience, then hopefully they'll pay for it. Because it's always going to be more expensive to get a drug out to the customer in his home than him walking to a store and picking it up. The day customer realizes it and says, listen, this is service which is coming to me, I value it, I'm willing to pay at least 50 rupees or whatever for the delivery charge, all other things being equal. That's when, e-commerce will really take off. I'm hoping that some of it has happened during this pandemic. People are valuing the services which we are offering. where, our delivery boys basically are, and the warehouse and all are working overnight. Delivery boys are basically, fighting everything from, the local regulatory guys to their own fears about the spread of pandemic to go and serve people out there. I hope that people actually value it and don't just take it for granted. When someone comes to their home to deliver it, they don't find faults with it and say, yeah, there's a dent here, there's this thing here, there's that thing here. Just value the service for what it is. Someone is coming out there risking everything to come and drop it off. Almost at no cost. Most of the times people are not even paying the delivery charge. Hopefully they value it, they value the convenience, and they appreciate it, and they're willing to pay for it. That's when the business will basically have legs. And I'm seeing some of that happening. Government doing green signal, red signal, really, Kushal, when has government stopped anyone, right? I mean, both my friend Gaurav and other guys out there have been doing their business. It's the market which takes it up or takes it down, right? I don't think it's the government. So great to have the government on your side, but I believe the market speaks, and I think it is pushing the entire thing towards the online channel, and that's really good for the overall e-pharmacy business.
Yeah, no, great question. Look, this topic comes up every time an e-pharmacy is discussed. So let me first state that, according to the laws of the country, actually e-pharmacies are absolutely legitimate today. At least the models that most of the larger players follow, which is that they take orders online, which is actually enshrined in the Drugs and Cosmetics Act as a facilitator on behalf of the customer. And then the IT Act or the Intermediary Act, which actually allows us to take those orders. And then the dispensation happening through, a legitimate local provider. So 1mg doesn't do any dispensation. It works with licensed facilities that actually do dispensation. They have pharmacies. In fact, most of the licensed vendors that 1mg works with, they follow the Drugs and Cosmetics Act in letter and spirit much better than, let's say, some of the larger, offline pharmacy ecosystem in this retail pharmacy ecosystem. So first of all, it's actually absolutely legitimate. And, just like Madhukar said, it's been a while now since 1mg has faced regulatory issues to the business, right? It's actually been a real while. And the government has been very supportive since the first pandemic. E-pharmacy got enshrined as an essential service. The same thing happened this time around. And in conversations that we've had, the government has always taken a similar stance that you're following the letter of the law, right? Which is that as an IT Act intermediary, you're allowed to take orders. As a legitimate, center, you're allowed to dispense, after prescription verification and stuff. So we don't see any issues that way. That said, I think the draft notifications which actually set out what are the right models to operate, because look, when things take off, people figure out shortcuts, right? We have had a lot of, Canadian style people also operate, flouting the rules and laws. So it'd be good to rein those in as well. So that would be a welcome notification. It doesn't make e-pharmacies legitimate because they are already legitimate. It basically sets, a self-regulation mechanism, if you will, for the e-pharmacies to operate in this country. I think the second is that the government's been very clear, though they still need to figure out this whole, FDI and the press notification rules, etc. That online is and will increasingly be a more and more important channel, right? And we just need to figure out a way to balance the needs of both the offline and the online channels, where the financing is very different, the unit economics are very different, and probably the needs of the two sectors are somewhat different. So if we can figure out a way to create a level playing field, and then just have the two channels thrive and serve the use cases that they are best, positioned to serve, I think that will be a great thing. So really, it's been fairly positive and helpful from the government's end. If we can get the press notification, I think that will be great, and it will just close a chapter and help us all move forward. But so far, it's been very supportive.
All right, gentlemen, many thanks for being a part of this very insightful panel discussion. Thank you so much for your time. Thank you so much.